Dr. Senthil Kumar Durai, Consultant Orthopaedics, Apollo Main Hospitals, Chennai. So now we'll talk about women and bone health. So the basic difference between men and women's brain is that the hypothalamus in women functions a bit differently. It serves to control the cyclical variations in a female, which is responsible for the female sex hormones and their secretions also. As you might know, the female sex hormone, also called the estrogen, is majorly responsible for bone mineral density and bone strength. So as the women age, the hormone secretion levels tend to decline more than the men. So the incidence of osteoporosis in women is comparatively higher, and that's why they might need supplement or treatment for osteoporosis in their older age. Now, apart from osteoporosis, women also tend to have more prevalence for certain diseases like autoimmune, arthritic, inflammatory diseases. The classic example is rheumatoid arthritis, wherein the body's defense mechanism works against the joints of the patient and then it tends to destroy the joints. So, prompt diagnosis and earlier treatment might prevent the joints becoming functionless. So otherwise, the patients might end up in surgeries. A similar kind of arthritis is called seronegative spondyloarthritis. These also mimic rheumatoid arthritis, the only difference being they don't test positive in the blood. The severity might differ depending on individual patients, and the treatment has to be titrated accordingly. Here again, prompt diagnosis and earlier treatment will make a big difference. The other group of disorders in women is soft tissue rheumatism, which is the soft tissue structures like ligaments, bones, tendons near any joint gets inflamed and then tends to produce symptoms. For example, plantar fasciitis, your tennis elbow, all this come under this group. Again, women are more prone. Early identification and then proper treatment will definitely help them. And then the last group, and the by far neglected group, is the psychosomatic illness, wherein the patients do not have an organic pathology as such, but then they would have referred pain all over the body, and then there is no test to identify it. These generally are not cured by medicines, but they need a proper guidance, meditation, and a stress-free work environment to get them out of this. This is by far a bigger group and then which remains neglected, and so the emphasis is very important. Generally, women should improve their diet practices and then exercise pattern so that they can come out of all these disorders which make them more prone than men.